Hi, I am Dr. Sudhir working as a cardiovascular and thoracic consultant and heading the department in Sapthagiri Hospital. On this World Hypertension Day, which is in May 2023, as per part of it, we are supposed to have the awareness. The theme of this year, as we all know, is to measure the BP accurately. That's the first line, followed by control it. Then the third is the benefit, which is to live longer. To begin with, why this particularly, why hypertension, control of it, why this awareness, as anybody are aware, any particular day when we are going to or we are going to celebrate, that marks something we are supposed to think about it, work about it, and try to solve it out in a very better way. When the World Health Organization did a survey, they found in the late 1990s, and which later came into being in 2004, that it is the most silent killer, and hence during simultaneously they also found it like awareness is the most lacking one. Of course, we are all fully aware, many hypertensive people, if you are there, if they have found out also, there are various measures, whether accurately is it the hypertension they are going to have or not, that's the one. To begin with, they have to know very clearly, are they hypertensive? With this, what are they going to prevent? They can have this cerebrovascular, cardiac events, renal and other periphery. All these things can be prevented. Now, first line is to measure BP accurately. Previously, no the BP was there, dietary modification had come, then the salt restriction, which is also the BP and salt restriction being one of the silent killer, it later came. Then modification, know your number, what's your blood pressure number. So before putting into the hypertension, knowing and being aware of BP, blood pressure, that is our own self number, is most important. This should be followed by, now with corona being over there, over these days, we have got almost all kinds of monitoring, and self-monitoring has become a very norm right now, and it is for good. The reason being, there is hospital hypertension is there. Seeing a doctor, any people, whether we were before a doctor also, so it's very normal phenomena to have little bit higher because of the adrenergic drive in the hospital environment. Hence it came, measure your own BP prior to these events. After that, now when you measure at home, this is most important because it will be in the stable environment, and of course diurnal variations of BP changes is well known. So this changes is a normal phenomena, and when you measure it, the other thing is how to measure it accurately is very much important. Like whatever the thing you are going to put over your arms, how you are supposed to keep, all these things everybody would be aware, and there is a marking over there in the diaphragm of the calf where is it appropriate for your hand or other things. With corona being over here, everybody are quite aware of home measurement, whether it might be BP and whole digital, we are quite aware. Now that's the point why this accurate measurement of BP has come into the being, and we are supposed to put it, document it in a paper about the timings also, so that we will have the diurnal changes, whether it is acute presentation or is it a chronic hypertension it is there. With this, first line is over. So you are aware of knowing your number, whether you are being categorized as being a hypertensive, non-hypertensive, do you have any other associated problem like chronic renal disease, diabetes or something other associated. With this basic thing, you will be knowing what are the markings, number you should be having. Generally, 140 by 90. 140 is the systole, 90 is the diastole. This is the one landmark which we have to follow whether you are having a disease or not disease. Followed by, when you are not having other thing, as a healthy without any other association, you should plan for little bit lower numbers like 130 by 80, or else right now the prescription is like 120 by 80. It would be the most idealistic one. Why this number is very important, why it varies with the other associated diseases. Getting into hypotension is also bad, whereas not knowing the hypertension is also bad. So we have to balance in a proper way and measuring accurately. Now, knowing the blood pressure doesn't make like you have to stop at that point. Many people, many local people, if you tell them that you are hypertensive, best thing is they should measure at the home, mark it down. It has to be documented and shown to us so that what are the changes which can be made. First, lifestyle modification would be there, dietary modification will be there, followed by any medications, any supportive or any associated disease are there, those can be managed. This will make sure that complications won't arise and appropriately all overall whole body as a system will be treated. Now, so second line is over, that is control it. So we are controlling it by measuring it accurately and appropriately also. What is the benefit of it? We are going to live for a longer. That's the thing. All human beings, we are trying to live it. Why? Before, when we are born, God gives us everything to be progressive. After some time, God tries to take it out from us till our death. So, we should not die very early for without knowing or which can be managed in an appropriate way. So, knowing the hypertension silent killer, which is the most important factor, as we all are aware of it, the nature is such a way that it always makes younger generation to carry on budding. It's all throughout in nature. But after some point, it makes sure like we are going to be eliminated. Why this changes occurs? That's the nature way. What are the factors which leads us to the death and how to control it? Hypertension is one among the thing, and if we can control it, our life span would be very appropriately in a very big way. Our whole lifespan would increase and probably we might be more beneficial for the others.